Mhm.
The emotional elevation oil that we just used,
Mhm.
how a couple weeks ago, I started really working more with Melissa as
Sure.
a system response, all those things you talk about with, Melissa. How does emotional elevation compare to Melissa in relation to what they're doing in the body? Like what's
Right.
about them?
So I would say you could look at it like a couple of different ways, but I would say based on like how we just did the ORIC programming and everything, the emotional elevation was meant to like shift the energetic mold or blueprint. You're shifting um like the holding pattern in the energy body for you to still be in this just maintaining negative emotions or homeostatic emotions, or you're going, okay, instead of generating this much homeostatic emotion, generate this much. That is in the aura, the blueprint, the energetic mold that we call the aura, the auric program. um, the idea of working with like Melissa or Alay, or that blend Alay, you're dealing more with the physical body itself.
Oh,
So one is the aura, and then one is like the effects or mm, the
mhm.
drives of the body. And the thing with Melissa, like there's different oils that are very good at calming down emotional, homeostatic emotions. It's hard to top Melissa. Even, you look at the idea of like St. John's wort or something. St. John's wort is very good for cleaning out the emotions and cleaning up the thoughts and some of the instinctive responses and things, but it still kind of doesn't do what Melissa does. You know what I mean? Like, I used to make this blend. I did it herbally for a while, and then I made it with oils. But it was St. John's wort, Melissa, and then valerian, and a very simple blend. But the St. John's wort has like a cleansing effect on instinct, emotions, and the mind. It's very purifying, and so that's why it's very good for depression. It's very, very purifying. And it's a blood purifier. I mean, it's just good on a lot of levels. And then the Melissa is very good for regulating the homeostatic emotions. And if we're starting to have anxiety or fear or anger, anything like that, the Melissa is very good for calming things down. And it makes the emotional body and the heart like more resilient. Like I used to kind of tell some of my friends who weren't too into aromatherapy, I was like, there's a few oils that you should probably do. And I was like, the Melissa makes the heart more resilient. Like you can take a punch, where, it's when I was younger and, some of my friends were breaking up with whoever they were with. And I was like, you got to take Melissa. You just got to take Melissa. And, it wasn't so much for sadness or grief, but, you know, it was to minimize like that emotional response or that feeling of like this is going to be forever, or you know what I mean, because that is a very emotional uh a drive. That's not mental. It's not even really physical. It's just something bad's happening. It just feels like it's happening forever. It's the emotional body is too like expanded, and Melissa's very good for regulating all that. And then the valerian is restorative, and it helps to reset the homeostasis. And so if the body is going through a chaotic state, or how sometimes you just feel like your tail spinning and you just can't pull out, like you're stressed out, you're not sleeping good, the body's doing weird things, and just the thing with valerian is it is very good for just resetting the drives of the body and helping to reset homeostasis. And so, if the body gets really chaotic, it's a thing that pulls everything together. And I'll give you an example of this is that if you have like chronic inner ear issues, like where you get vertigo and you're starting to have like loss of balance and everything. If you do valerian every night for like say 30 to 60 days, it will reset the inner ear. Like it just, because a lot of that is tension in the neck and the way you breathe and your diaphragm, but the body is just feeling chaotic. And so the breath is all off and it's making the muscles in your neck weird, and the muscles in your neck directly impact the inner ear. And so, you start having balance issues, and walking a straight line becomes a little hard, and you might have a little bit of vertigo. And so in acute cases of vertigo, you would use something like hyssop, or larch, something like that, where you deepen the breath, you loosen up the neck muscles, and you're good. But when it's a very chronic problem, if you take it every night for 30 to 60 days, it will reset the inner ear. And even in Orthodox medicine, in the point of view of, medications, that old school medication Valium is a synthetic version of valerian. And even in the old days, doctors, like if you had a really bad inner ear issue, they would give you a really low dose of Valium, usually like 2.5 milligrams or 5 milligrams, and they would give it to you for 30 to 60 days, and it would reset the inner ear. So when somebody was getting older and they were starting to have that weird balance issue or weird inner ear issue, you would go through and treat it with that. And really what you're doing is you're restoring the body, you're restoring a balance or equilibrium in the body. And so Melissa does that emotionally, where Valerian does it in your physiology itself. The Melissa does it in the homeostatic emotions. Like it just helps to hit that equilibrium again.
Mhm.
Yeah.
It's
So
interesting.
I would
Yeah.
say the combination,
Yeah.
aura, then work the body. It's the whole idea of like, how, we did the deep dives on the aura, and then we kind of stepped away so that we could do the deep dive and the vibrational healing. And really, if you bottom lined what is vibrational healing, it's really not looking at symptoms anymore, but it's looking at like, why are these symptoms arising? Why is the body not getting better?
Mm.
Why are these things there? Why are they happening? And so then you just start like kind of reconditioning the body to produce the kind of results that you want. And it doesn't mean that a symptom-oriented approach isn't good, but a lot of times it can't. You might resolve something and then it comes back, or, you feel better for a day and you can't sustain it. There's something in the vibration of the body, so if we look at the body is in more fight flight than rest and repair, the nervous system is imbalanced, the breath is off, you just start looking at things and going, okay, let's correct these things so that, the body functions better. And as the body functions better, it also starts releasing things out that again goes back to the aura. So that's why when we're doing the aura program in the first wave of things, I was like, do it before you do like your normal treatments. Like if you're treating like a gut issue, do the aura programming, and then go through and treat your gut or treat your respiratory system or whatever it is. But when you start doing deeper work on the body, where you start going deeper into the respiratory system or into the digestive tract, then at some point you do the auric programming after the fact, because that stuff's expelling out of the body. And then you go through and you clear it out of the aura, and boom, you affect like change.
Mhm.
Yeah.
Fantastic.